Welcome back to COVID Corner. We've heard lots of public health and medical experts in the news recently, but we've heard little from patients with COVID-19. We've also received several questions asking, what do patients feel like when they have COVID-19? And other than the respiratory problems that patients with COVID-19 have, what are other issues that they have? Well, today we're excited to have Dan and Stephanie Burke join us. Both have been infected with the SARS-CoV-2 virus, and each had different experiences, one more moderate, the other more severe. Thus, I think their insight will be quite valuable for physical therapists as well as other healthcare providers working with patients recovering from COVID-19. As a brief introduction, let me just add that currently Dan and Stephanie are the president and director of the Avila Institute for Spiritual Formation. And Dan is the former president of EWTN News, a position he stepped down from last year, actually due to some health issues that he'll likely discuss shortly. So I first heard the two of you interviewed on EWTN Nightly News over a month ago. I think it was early April. And I also read about in a national news story as well. However, I kind of came to know about your story kind of early on, maybe even kind of the day you were hospitalized or on the way to the hospital. My wife's prayer group was meeting and got a request to say that, Dan is in the hospital or Dan's going to the hospital and he needs our prayers. And so I kind of was familiar with it very early on. So I know a little bit about your timeline. I've heard your symptoms began on March 17th, so a little over a month ago. And you think you contracted the virus, or you're pretty sure you contracted the virus while you were traveling domestically. When and where do you think you contracted the virus?
It was the day we came in from Dallas, Texas.
On March 9th.
And that's when we picked it up, because we had a meeting in Dallas and we were very, hugs and hand holding, shaking and eating together. And we met with a bishop down there.
Family members.
And family members, nobody got sick. So the only thing we know of is coming back from Dallas on the flight.
Or at the airport.
Or at the airport, because we had no contact with anyone who had the virus that we were aware of in any of our social circles. So that's where we think we got it.
Mm-hmm. Yeah, and we started to have symptoms on the next Tuesday. So that would have been the 17th, I think. Later in the afternoon, Dan was complaining of a severe headache, not just a passing thing, to where he went in and started to lay down because he didn't feel well. I don't know if he was running any fever at that point. I wouldn't have thought to check at that point, but later that evening, I started to feel bad. And then by the next day, we both had stuff going on. It manifested a little differently. For me, it started with, I got the headache later on, but with me, it started with what I would say is postnasal kind of drainage. Like I was having a sinus infection because it wasn't allergy related. At that point, and I mean, y'all are doctors and stuff, so you understand this. It tasted different in my mouth, in my throat. Mm-hmm. And so I thought, no, that's illness. That's not allergies. So I knew that I was coming down with something. Still, we didn't necessarily suspect COVID. We just, we kind of waited things out. At the beginning, my lungs started to be affected sooner. I started to have a cough fairly quickly after that, feeling like I was developing bronchitis. I'm prone to bronchitis anyway. My dad was a smoker, even though I do not smoke. And I felt like I was coming down with bronchitis.
And what was that cough like? I mean, was it a productive cough? Was it just a kind of a dry, nagging cough?
It was kind of a nagging cough at the beginning. It wasn't productive until a little later. It was well within, maybe 5 days after where it started to be productive. And by the end I had full bronchitis, very productive, all the junk that goes with it. And I really could only manage my lung issues, coughing, the chest congestion that I was feeling, I used Mucinex DM constantly. I would do it, the 12-hour release. I was taking it morning and night. And I know that that's my first go-to when I have bronchitis, because it kind of keeps me manageable.
That's interesting, because a lot of what we've heard kind of as professionals is that, there aren't a whole lot of secretions and mucus isn't much of an issue, but you definitely had a.
Yeah, I didn't have, my cough was dry and low irritation, low in my throat.
Mm-hmm.
So it didn't have that element to it. But my lungs, I have chronic asthma. So not like chronic, to give you a sense, is I have a nebulizer at home. And before I got sick, I had been in decline for 3 years. And I used, at home, I was using.
Before you were sick, you were using it how often?
I was using it regularly, I should say that. And I was using steroid and normal albuterol, the normal stuff, along with the steroid, inhaled steroid.
And you were doing that on a daily basis? I mean, the inhaled medicines?
Weekly, at least?
No, it was, before you got sick, it was daily because you stepped down from EWTN.
Yeah.
And you were, I would have called you chronic at that point, and that was before you got sick. Because that's when we kind of, you were able to manage it with the meds.
Yeah, I didn't have to go to the hospital.
Right, but he was having to use all the meds, all the nebulizers and inhalers several times a day to manage it so that he could function and work.
Yeah.
So, he lingered for a while where I was doing worse than he was at the beginning, probably because he was on all those meds that were managing it. But then we turned a corner, and where mine didn't, where my lungs didn't progress any worse, his did, because he was no longer able to manage it with the meds.
Yeah, I got to where I had to use the maximum dose in the earliest possible time of the nebulizer medication, whereas before it was only on an as-needed basis.
Right.
So I was using maximum dosage, and my lungs continued to deteriorate. So that's really when we decided to go. We have a doctor friend. Well, I don't know him. I couldn't even identify him, but he's a physician who's at our parish, who knew about my condition and called us and said, "Hey, you need to, UAB has an infectious disease unit. I know about your condition. I really think you should go."
Yeah.
And then so we went.
Yeah. And I want to mention too that some of the other symptoms that showed up, at least for me, and I'll let Dan speak for himself, I did have intestinal issues. Obviously my appetite completely went away while I was ill. I didn't have really much sense of smell, and I had no desire for food. And then I had the intestinal issues where I didn't vomit, except I felt like I was going to one night. And it got so bad that the room started to spin, that I had a sense of vertigo, where I was grabbing a hold of the sides of the bathroom wall so that I wouldn't fall. And it was so debilitating. I actually crawled from the bathroom back to the bed.
Oh, wow.
Where I could call Dan to help him, to get him to help me stand up so that I could get back in the bed. And that was after laying flat on the bathroom floor. And you'll appreciate this as a Catholic, or those of you that are Catholic, I was just kept saying Hail Mary, full of grace, so that I wouldn't pass out. I didn't want to pass out on the bathroom floor. So it passed, and then I crawled back because I couldn't stand. I was too weak. Even though I hadn't gotten sick, I could not stand. And you know.
I mean, assuming you've had the flu before, this was unlike, I'm guessing unlike anything you've had before.
Yeah, it was like a really, really bad flu. The body aches that I had were very sharp, you know, all over, legs, arms, you know, the severe headache.
Very sharp. The body aches were different with the normal, because I had a really bad flu in December, I think it was, when we were in Santa Fe.
Mm-hmm.
And, you know, it was bad. It was among the worst I'd had before COVID. But the body aches were very different in COVID, both before
Mm-hmm.
hospitalization, during and after. The muscle recovery was very very painful. Whereas in a normal flu, I'd never experienced anything like that.
Yeah, and we both had fever. Dan's would get much higher than mine. You know, I don't think I went above maybe 101. He got into the 102, 103 range while we were at the house. And I was trying to use cold compresses, and we were doing everything that we were told to do, but it wasn't even the Tylenol that we were directed to use wasn't cutting his fever. And so that was when we talked to the doctor and realized that we had to go to the hospital.
And so then you went to UAB's emergency department, and then they decided, as bad as you felt, Stephanie, that you didn't need to be admitted, but Dan, you did. Did they give you any recommendations, Stephanie, other than what to do at home, or
not much?
Or
go
stay
home,
away from other people?
Stay away from other people, make sure you're isolated. And, they asked me what I was doing, and I told them the Mucinex and the Tylenol, and they said, okay, drink lots of fluids, go home, and so I did. I came home to the house where it was totally isolated. And I was very sick for a number of days after that, until Dan started to come out of it, and then I started to feel much better. Once he got out of the ICU was kind of where my turn came. So I was probably pretty debilitated for the first, after we got sick, about 7, 8 days, and then things started to lift slowly,
Did you have any kind of, Stephanie, any kind of functional issues? I mean, like, did you get short of breath easier? Did you have any trouble like climbing stairs, or?
Yes. Yeah, that was a big deal. And we have 3 flights of stairs in our house. So, going to the kitchen was a big deal. Coming up from the kitchen was a big deal. I mean, everything was a big deal.
How long did it take you to kind of get your endurance back after that?
After it was a good 2 to 3 weeks. I would say that I really wasn't normalized until probably a month later, where I would say I feel like myself again, and I have my strength back.
And me as well. And I would say I was very aggressive when I got out, in terms of once I could walk, because when I got home, I couldn't walk on my own. I had to use a walker. I was too dizzy and too weak. For the first day, and then the next day, I used a cane. I think I used a cane for 2 days, because we have stairs and they're not, it's not a minor thing when you're feeling off and weak. So, but once I could stand on my own, I was working outside in the garden, and I was in no way passive in terms of recovery, and it still took, and it was very painful. It was like, you go and do a workout and you feel okay and your muscles are sore. Well, it's like 10 times more painful than that, up until, I don't know, like a week or so ago, 2 weeks ago.
Oh, wow.
Yeah.
3 weeks ago, I think.
And then,
I would say 3 weeks for you, because you've been great.
And then my lungs returned better than they were before I got COVID. So I only can attribute that to prayer. If I got the remdesivir, I don't know, maybe that affected me, I don't know. But my lungs were pretty bad when I got home. But I was, and it took a while for that to come back too.
Yes.
Yeah, Dan
so
had secondary pneumonia when he was,
Yeah, that's
he
right.
developed that in the hospital.
Yeah, so before we kind of go there, let's kind of take us back to the hospital. So, Stephanie, you came home from the ER and kind of slowly kind of recovered on your own there. Then, did you go straight to the ICU or?
No, so I was admitted to a normal room, but within a few hours, my oxygen, I guess, kept declining, I think, is why they did it. I went into ICU.
Okay. And were you in the ICU for long before they decided you needed to be on the ventilator?
I was pretty fast.
It was within the first day.
Okay.
Yeah, it might have been within a few hours after that. So he declined pretty quickly. So the decision to go to the emergency room was a good one. I don't know about the ventilator piece because I know there's some questions as to whether that's the best way to treat this now. But you know, after he was put on the ventilator, they called me to allow me to say something to him before, or have us speak to one another before he went on the ventilator. And once he went on, he wasn't doing well. But 3 days later, he pulled it out on his own. He twisted around in his restraints, pulled out the intubation tube, and he didn't remember it because when I told him that the nurse told me this, he looked at me like the shock was, you know, it just,
I remember the aftermath, but I didn't know what it was about because it caused a lot of commotion, obviously.
That it did cause a lot of commotion.
Yeah, but I didn't know what that was about until she told me, and then I went, oh, that's what I did.
Yeah, and what was beautiful about it is when the nurse called to say, well, Mrs. Burke, you know, I wanted to let you know this happened, and I went, he did what? You know, and but she said, but he's doing well and he's stable, he's breathing on his own, and his you know, saturation with his oxygen has gone up to 100%. And he stayed there. You know, they left the, you know, the mouthpiece and the kind of stuff ready to do it again if they had to. But then they just started to strip it all away because he was breathing on his own.
And so I know, I've heard you say you'd had many hospitalizations in the past. Have you ever been on a ventilator before?
No, never.
Okay, so this is the first time. Do you recall much about, I mean, you don't recall pulling the tube out, but obviously you weren't, well, when patients are on a ventilator, oftentimes, historically, we used to keep patients, or, you know, physicians, nurses, we keep them very sedated to kind of prevent something like this. But then we've kind of learned that there's a lot of unintended consequences of keeping people sedated for long periods of time. And so now we try to balance, you know, in the ICU, you know, keeping patients kind of calm enough that they don't pull their tubes out, or they're, you know, oftentimes you probably had a line in your neck too, you know, which if it came out would have caused even more trouble. So they try to minimize that amount of sedation. Do you remember being awake at all while you were on the ventilator?
Yeah, I mean, but it's hard to at the time, because I remember having it go in and having to cooperate with that. And then I remembered kind of in and out of consciousness during that time. But that period, yeah, I don't have a ton of memory. It's all very vague.
And he was sedated, they told me.
But only partially.
Yeah, it was they called it light sedation.
Yeah.
So, Stephanie, when you heard that he'd kind of extubated himself, what went through your mind? Both?
It was just a moment of, please tell me he's okay, because I was thinking about his, you know, his throat and his esophagus, his vocal cords, you know, anything that might have gotten in the way. I don't know anything about intubation, but I had enough of a sense of things that it worried me. But, you know, it also didn't, it was a, you know, I know that you've heard our story, but when we took him to the emergency room, and I know this is not what this is about, but I think it's important for people to understand the truth of it, is that I did hear internally 3 days. when he was separated from me in the emergency room, and I knew he was going to be hospitalized. And I could only attribute that to an internal sense, an inspiration, you know, God's voice to say to me, it's going to be 3 days, don't be afraid. And I held on to that sense of 3 days. And I will tell you, we had thousands of people praying for him all over the world. And in 3 days, I got to see him, and he had pulled out his intubation tube. And he didn't know I heard that. I hadn't been able to talk to him. He was sedated. Doctors were taking care of him. I couldn't even see him. All I could do was pray and send out updates. And to me, and the fact that he's doing incredibly well, it is in itself a miracle for me, you know. And I'm gonna claim that for me, because I believe. And what's also remarkable, and I don't know if Dan has mentioned this in any kind of correspondence, but you know, they put him on a blind study with remdesivir and a placebo. We don't know which one he got. We'll probably find out in the next few weeks, but they didn't do that until he was already out of ICU. He was back into a regular room, so it was towards the end, and they asked him if he would consider being put on this medication. The two other people that had started at the same time, the other person died, and the other one was still hospitalized a week or so ago. So that was weeks and weeks after Dan had been released. And so the doctor who was, you know, drawing blood and doing the tests and such said, I'm very glad to see you. So out of the three, Dan was the only one that survived that. And they had similar conditions, secondary conditions that would have complicated this. And so for me, that's another aspect of the reality of prayer. And, you know.
And good medical care. And we don't, I'm sure you'll get to this or wonder about this. We have no complaints. I wish when they called her, she would have said, first, let me tell you he's okay. Now let me tell you what he did. It sort of went in the reverse, but, you know, still no complaints. Being in the hospital, one of the hardest things was the isolation. But I deeply appreciated the nurse saying, I'm sorry, I can't attend to you as much as I would like because of the way things are. And that was helpful to me to know that. And then things got worse because the garments became, the protective garments became less available. And at one time I actually had to crawl to the bathroom after I woke up and was not intubated. I knew things started to move, and I knew I was going to have a serious problem. So I knew that the nurse wouldn't come quickly enough. So I rang for the nurse, and then I crawled to the bathroom, which is a joy on a hospital floor. But
and so you crawled. So you didn't feel strong enough, or you felt unsafe trying to walk?
Oh, I couldn't walk. No, I was too weak and too dizzy. So it was even hard getting to the floor, feeling okay getting to the floor. Then once I'm on the floor, it was okay. But then there are other maneuvers that, you know, that were necessary. But
something to mention that I think is important, which was very, very strange for both of us, and we've heard it from other people that have recovered from COVID, was the mental fog, the kind of this weird difficulty thinking, difficulty having clarity, doing strange things, like I was starting to forget things and put things in strange places where I would be completely shocked by it, you know, like
for about a week after.
No, that was a couple of weeks.
Was it?
It took a good 2 weeks after they said, okay, at 14 days, you're clear, you know, you don't have to be isolated anymore. But the mental thing, whatever that was very difficult and very strange. I actually worried that we would have difficulty because we speak, you know, we speak all over the country. We have a radio show. This is the kind of work that we do, and I was concerned about about the difficulty.
So this will give you a very specific indication of how foggy it was. So because we're part of a community, a Catholic community, so we pray a certain way every day. We have what's called a rule of life that we follow, and I've been doing it for years, and I use this sheet Monday through Friday, Sunday and I write it down every single day, every week. I write it every week, right? So it's memorized. Well, I forgot I even had this for days, whereas I use this every single day for probably more than a decade. And then one day, it was a Thursday, I remember, just like that, the lights came on and all my memory came back, and all the things that were waiting for me to do that I had forgotten all about, and all the people were waiting on me, and all the tasks I had to do. But it was just one day where the lights went on and I was fine. I kind of declined a little bit another day later and then came back. But for the most part, it was uphill from there.
Yeah, but that's a big part of the recovery process.
Yes, we've heard that from a number of people, that it's not just physical, but mental, emotional, spiritual. So kind of getting back to how you were doing, you crawled to the bathroom this one time. Were you ever seen by kind of a physical therapist or an occupational therapist in the hospital?
I'm sure, but I don't remember.
I don't think you were then.
But I don't know.
Yeah, I know for a lot of patients, I mean, I think they tried to, because of, like you mentioned, the kind of the rationing of protective equipment, they weren't seeing kind of everybody like they may ordinarily. So when were you able to, so you crawled that one time, how long was it before you were able to kind of walk with a walker, you said?
When we got home, I walked with a walker out of the car into the house, and then all day that day, or the next day, because we got home at night, and then all day that next day, and then the day after that is when I went to the cane. Okay. So I only one day, one full 24 hours period was the walker.
Did they send you home with a walker from the hospital, or did you just happen to have one, or a friend?
Called her and told her she needed to get me one.
Yeah, I had to get him one, and I've learned that my husband knows his body more than more than doctors and more than I do. And he said, I'm not going to be able to walk. And he really, what would have normally taken just a matter of 2, maybe 3 minutes to do, took us 20 minutes from the car to get in, just through the garage, up a little flight of stairs, then 2 other flight of stairs. I mean, he had lost about 15 pounds. So he was really, really thin. His clothes were hanging off of him. I mean, I talk about that. That's when I went, I don't know if he's going to be fully, healed from this. I wondered if we were kind of seeing a new life ahead of us.
Have you put back on that weight in the meantime?
Well, I only really want to put on 10 or 5 pounds. So yes, after when we got home, I was nauseous a lot, and I don't know if it was the pneumonia stuff, but I had a really nasty taste in my mouth all the time. Food was weird. Nothing tasted good. Everything made me sick. And so it was hard to get back eating. So I don't know.
Yeah. Yeah.
Did you have any trouble swallowing? I mean, your voice sounds good.
Yeah.
At the beginning,
At the beginning, yeah.
It took about 48 hours, I think, until he kind of got comfortable there, because he couldn't really speak the first 24 hours. And then the next, after, he had pulled out the intubation.
Right.
Did you guys have to alter your house setup at all? Like move a bedroom, things like that?
Was it possible? Not the way our house is set up. So it was like, nope, we're going to get up these stairs and get him into the bedroom, and I can bring food, and thankfully, mercifully, You know, I had a little bit of strength by that time, and I could take care of him. If that had not been the case, we would have had serious problems. We would have had to have somebody come care of us.
And now we're pretty strong-willed people, you know.
Obviously.
You know, like for me, it's to hell with the stairs. I don't care. I'm going up the stupid stairs. I'm not sleeping on the couch. I'm not playing. This thing's not going to do. My will has always exceeded my body's abilities, but which caused other problems. But so as soon as we could move, we weren't gonna. Even if we could, I don't know that we would have. We would just, you know, said, because you got to get well. I mean, you have to move. You got to walk. You got to. You know, I had more surgeries than I can count, and I just know the sooner you can move, no matter how much it hurts, the better. And so that's what my attitude was. I struggled emotionally. This was by far the hardest experience I've ever had in the hospital. And I think that's mostly on the spiritual level. I don't know that it had as much, because I've been through this over and over, hospitalizations, surgeries, and all of that. And I've even, you know, I'm predispositioned to think of hospitals like psychologically in a good way, because I've been hospitalized so many times, mostly for my lungs, and the treatment always works, and always works fairly quickly, and really makes me feel way, way better, right? So from a childhood to my adult, hospital good, you're gonna feel better soon, you know. And then also spiritually, I'm really ready to die. I'm not afraid of death. You know, I just have I don't have any fear of any of this kind of thing. But it was dark for me. But only thing I can attribute that to, the darkness is more of a spiritual, if you know John of the Cross kind of thing. But that was hard, because even when I got home, it was hard for me. It pushed against my will quite a bit, in terms of, I had to fight a lot harder than ever before to get out of bed, to not be sleeping too much, to get outside. You know, I worked like 8 hours in the backyard. How soon after?
It was maybe a week and a half.
It was that far?
2
Felt
weeks.
soon.
Yeah, it wasn't that soon, but
Yeah.
I mean,
Part of that mental fog.
Maybe a week, yeah.
Yeah. So.
Yeah, he started to get out once it was warm. You know, I have to say that I think part of the issue with COVID is all the media and the speculation and the fear. It is so detrimental. And so with all that, you know, people they're panicked, they're afraid, they're isolated. The isolation is horrid. We're not meant as social beings to be isolated like that.
Especially when we don't feel well.
Right. And, you know, it was a full 3 days before, it was the morning that later he had pulled out the tube. When they put the video, you know, there's some sort of, they have the ability to use an app, you know,
right,
for the room and the UAP. Well, you know, I mean, understandably, they're worried about taking care of him. They're not, you know, worried about, you know, taking care of the isolation bit, because they want to make sure he's stable. But it's very, very hard, you know. And then even when he was lucid and off of that, to be another, you know, 5-6 days like that, not seeing very many human beings
and no faces, you know.
No faces, you know, it's weird.
Yeah.
It's hard.
Were you able to communicate with him kind of on a somewhat regular basis once they kind of gave you the camera or the?
Yeah, we were able to FaceTime on his phone. I have to say the doctor was amazing, our friend, because I said he doesn't have a charger, and he was able to get him a charger in his room, so his phone was charged. And so being able to FaceTime him, but even with that, it was hard until the very last day when I picked him up, that that I was concerned about him because his emotional state was not good. You know, psychologically, emotionally, spiritually, you know, he never lost faith, but it was hard, you know, and again, it's that isolation is tough.
Yeah. And I know, I've kind of heard it before, but I'll just kind of mention it now. I know, you know, you were very scared, kind of, Dan. I heard the story that you were kind of finishing your will on the way to the hospital, you know, so you were obviously concerned that the outcome wasn't going to be as good as it is.
Yeah, just in terms of psychologically though, I'm, you know, I have a lot of different emotions and weaknesses and whatever, but I wouldn't characterize it as fear. For me, it was just practical. For me, it was just like, okay, I'm probably going to die. And we didn't finish our will. We actually started working on it last year and we didn't finish it, and I needed to take care of my wife. And so that it was more matter of fact for me, just because, you know, I've been close to death a lot of times, and I've had emergency surgeries, ambulances, and, you know, just all kinds of stuff. But this was different. And then I just had the sense it was different, not because of the media, just because I knew I knew the death rate for people who have these underlying conditions. I'm not young anymore, like Ashley. And notice I didn't say that for John, actually.
Yeah,
but
I realized that.
I'm not young anymore. And so I just thought, you know, it's probably going to be it. But going in, it was just hard. And, you know, when you have trouble breathing, the other thing about this kind of this traumatic lack of breath thing is, no matter how calm of a person you are, and I'm pretty calm, and I've been through it a million times. So, but when it can't be remedied hour over hour, the stress in your body builds and builds, because you know what, you guys are in the medical field. I don't really know how it all works, but I know my body knows when it should panic, in a sense, right? Like you're in danger. Right? You're underwater and you're too deep and you're too far from the top. You're too far from the air. And so the longer it went on, I think the more stressed I was, in that sense of physiological, which causes psychological, and there was no remedy. So usually I could get to a remedy within hours, even at the worst case. So in this case, it was worse, that I get intubated. That's very stressful on the body, even if you have a very healthy, positive mind and heart and disposition, because I'm generally an optimist. But it you know, after a while, all that goes away, because it's just like, well, my lungs are going to just stop working, you know.
And so I think one of the hard things for us as healthcare providers, or people without any kind of health condition, especially kind of a respiratory health condition, is, you know, knowing what it feels like to be short of breath. I mean, you know, we can, you know, run up a few flights of steps, or, you know, run really fast, and kind of, you know, we get kind of winded. But I think that's a completely different feeling than somebody like you that has asthma or with this condition. So I don't know, how was your kind of perception of your shortness of breath with this compared to kind of previous episodes of your asthma?
Well, I had a really bad year before last, which is one of the reasons Stephanie quit her job and came home to take care of me. I had a really bad situation where I was coughing so bad, I would lose consciousness, and then
Cough syncope.
Cough syncope. And then coming out of the syncope, it was the hardest, most traumatic short of breath scenario I've ever had, because I would try to suck in my lungs and breathe as hard as I could, and I couldn't. And it felt like, you know, you lose complete control. So normal asthma, you always have this sense of there'll be an end. In this case, there was no end. So it's just, you know, you can feel it. You can make yourself feel this. Close your throat and try to breathe in. And then feel what it does to your body. And do it as long as you can. and you begin to get this sensation. And I don't know what that is physiologically, but it's like, hey, something really bad's going on. But do it for a little bit, and then have it extended over a long period with not quite the severity of a total blockage. And it really causes, and it's hard, like I say, it's hard for me to describe, because it's not a fear or a thing like that you're cognitively thinking, I'm going to die. Your body is saying you're going to die, and you need to fight to breathe as hard as you can. And you're sort of, it's like I've been in severe pain before, and the entire orientation of your psychological state and your physiological state is to deal with that pain. So then when you can't breathe, it's similar. The entire orientation of your being, and you don't have to think about spiritual, but your physical and psychological is about figuring out how to get to the top of the water where you can breathe again. And so for me, I think I have an advantage in that I am a positive person, and I am a peaceful person, and I have the ability to deal with a lot of stress. I mean, I manage a worldwide news organization, so, and I've been sick all my life. For someone who's never experienced any of this, it's got to be even way more traumatic. It was traumatic for me. On a scale of 1 to 10, for me, it was a 10. I don't know what it would be like for someone where this is newer for them. It's got to be just devastating and incredibly difficult. So
yeah,
it's hard to put into words, really.
Yeah, I think you've obviously got a very strong will, and it's patients like you that don't become patients of ours. So as physical therapists, we treat the patients that have more severe consequences and sometimes aren't motivated to do the things you did.
Yeah, my goal is to just drop dead one day, not to decline slowly, So
Yeah,
I'm not interested in that kind of life.
Yeah, from your lips to God's ears. So currently, kind of related to kind of your mobility, how well you get around, your endurance, your kind of memory, do you feel like everything's kind of back to baseline for both of you?
For me, it's better than what it was before.
mm-hmm.
Better than before.
Yeah, because I had been in 3 years of decline, and I at present I take the maximum dose of the strongest treatments for asthma to keep them under control, and those were not working before I got sick. So then I was constantly on the nebulizer emergency medication. So now I haven't taken the nebulizer for weeks.
Mm-hmm.
Like I had to travel with it, to give you a sense. I mean, I could not be without it, or I'd end up in the ER. So.
And now you haven't used it for weeks.
Right.
Weeks, and it's, I mean, I'll tell you, it was nuts, because I saw it on his nightstand and he hadn't used it. So then I moved it to the bathroom and it stayed there. Then I moved it to the sink, and this was over the course of days and days and days, still wasn't moving. And he said, oh, do you want me to wash this? And I said, yeah, why don't we get it all cleaned up now that we've sanitized everything in sight. And he did. And then it stayed there for another week. And I thought, I don't think he's touched that. So I bag it up, put it under the sink, stays there. And then I realized he's not using even his inhaler. I think maybe once a day,
No, not that much.
So,
but every other day, every 2 or 3 days, I use the emergency inhaler. And I've been working outside almost every day.
In high pollen season.
Right.
And I'm thinking, what is going on here? Because I mean, I know my husband, I'm with him all the time. And all of those meds are gone, And so I mentioned it to one of our community, and she just kind of smiled at me and she said, well, she said, we weren't satisfied that he just would survive. We've been praying for his lungs to be restored. completely restored. We didn't know they were praying for that. So there's another miracle, because I'm watching my son, my husband, and he's out in the dirt and working in the backyard in the pollen, and he's fine. If that's not our reality, prior to COVID. It is now. Yeah.
So I mean, you're not using your medications like before, but even physically, you're doing as much physical work as you did before.
More because I started. I have a goal of walking 8,000 steps a day minimum, and then I also have a goal of daily exercise. And I had started an exercise program prior to getting COVID, but I hate exercise. So what I decided to do is work up a sweat outside and finish the 473 projects that I have going in the backyard and around the house. And so what's driving me outside is the spring weather that's been amazing here in Alabama.
Yeah,
and also the desire not to use exercise equipment inside my house. So I don't know if I answered your question.
But yeah, but he's been doing a ton,
every day.
Wheelbarrows full of big rocks and rolling them around all over our house and landscaping and it's
not in the house.
No, outside.
No rocks are allowed.
No rocks in the house. That's good.
In the yard, yeah. So anyway.
One of our phrases that we like is exercise is medicine, and physical activity is medicine. And so if you gotta take it on a regular basis, just like like you used to take your nebulizer.
Yeah.
If you stop the exercise, things start to kind of go down. But
and
I sounds like you're on a good trajectory now.
Yeah, I run up the stairs habitually, and then I also go side to side to keep my hip muscles strong because I busted my knee a few years ago. So I know it sounds funny, but that's what I do. If somebody watched me from behind, they might think I was just being silly, but
I'm sure that's not the case.
No.
Well, I've got just a couple more kind of questions here for you. For us as kind of physical therapists, as healthcare providers, from your experience, is there anything in particular you think we need to know? I mean, you mentioned kind of the communication during this kind of isolation period is important. Any other kind of lessons that you haven't already mentioned?
Well, I mean, there's nothing you can change. I think I have one complaint that on a scale of 1 to 10 is a 10. And that is if you can get garbage guys in the room to change the trash, you can get a priest in to pray for me. You know what I mean? So, and I don't mean you, but I mean just in general. And I think that there's been a dramatic overreach in civil government and the insanity of the news. I so appreciated going into the clinic as I'm participating in the study, and the doctor says, a physician who's also a scientist says to me, we can give you a mask, it doesn't do anything, but if you want one, it'll make you feel better. It's like, I like that kind of honesty, and I understand the benefits of a mask if you're sick and not transmitting, and I know why nurses and doctors have them and all of that. But I think realism, honesty is really important. I'm sorry I won't be able to see you as much as I'd like. I'm sorry it's going to be worse because we've run out of gowns. That's really helpful. But you really got to get, you guys know this, the emotional state of a patient is really critical to their recovery. And I know, for me, Stephanie's always been at my side every time I've been hospitalized. And it was a big deal not having her there. I mean, of course she was sick. And I get it. I'm not knocking the system. I mean, prayer is why I think I'm here. Good medical care, excellent medical, UAB is a great organization, in my opinion. But I do think if you can get a trash guy in there, you can get a priest in there to pray over the patient. And thankfully, my wife got one of our priest friends to call me and pray over me, when I was in there. If you can't get someone in, then work really hard with the family to say, would you like to get a chaplain on the phone or your priest on the phone, or, just trying to figure out ways around the problem. But I do think we can get a trash guy in there. We can get a priest in the room, to anoint people. And I'm grateful to live in Alabama in the old, we're a bit backwards, which I think is perfect. It's old America. But I didn't like that. That's my big thing. But in terms of UAB, if somebody said, how was your care, I'd say A+.
I've had great care at St. Vincent's too, so I love them as well. One thing that I would say, because I don't have underlying health conditions, right? And I survived this. And I think the idea of this, and I would say this based on just, our experience, for those that are chronic, that have chronic conditions or underlying conditions that make them more susceptible, we should absolutely help them and protect their environments and all of those things. That is all right and true. For the rest of society, if you don't have those, we need to allow them to function properly. Because I think in the long run, and this is even through the trauma that we've been through, the isolating and the shutting down of society is going to have a worse effect than any of this. And in the long term.
And you're not in a position to affect any of that.
No.
So
We're just sharing.
Yeah.
You asked.
It's really scary because, obviously we work with people that are survivors. And so that's kind of the first threshold. But then I heard the other day that the incidence of hospitalization due to stroke is down 40% compared to this time last year. Mm-hmm. It's probably not people are 40% less likely to have a stroke this year. They're just not coming to the hospital. And so now they're dying of stroke, or they're suffering greater debilitation because they didn't get the appropriate medical management for stroke. And so I think as PTs, we're going to see a lot of secondary consequences of this.
And the people with depression and suicide because they've lost their jobs or their ability to care for them. We just met a couple today where he got furloughed. They don't have money, and I think they're having to move to sell their house to move to deal with the consequences of that. I mean, we're going to see fallout for months, probably years on this, because I think of this panic to shut down everything, and we don't even know that that's going to help. The chronic, yes, all of that. I've already said it, but for those that are young and healthy who want to function normally, they should. So.
Well, Stephanie, I heard you say that you rallied the troops into praying for Dan. And as I mentioned earlier, I was kind of well aware of this because of my wife's prayer group getting your message. And although the numbers vary, I've heard as low as 25% and as high as 75% of patients that go on a ventilator due to COVID-19 don't survive. Currently, almost 90,000 Americans and about 500 Alabamians have died due to COVID-19. Thus, many people aren't as fortunate as you two. What words of comfort do you have for those families who have lost loved ones due to COVID-19?
Yeah, I mean, God has not abandoned his people, and that's whether you believe in him or not. We're all God's children, and he doesn't abandon us, and we don't always know why terrible things happen to good people. And it doesn't make Dan a better person. It doesn't make him luckier. It just means that his mission right now isn't finished, and there'll be others that we don't know, why their time came to an end and for what purpose. But words of comfort are begin again, begin to live again, and to hope again, and pray. And if you don't have a relationship with the Lord, find one, seek it, reach out to us, we'll help you. And Yeah. Life is worth living. So we don't let the fear and the pain and the suffering crush you. Begin again, you know.
Well, thank you again, Dan and Stephanie Burke, for joining us today. We appreciate your insights into the physical, the cognitive, the emotional, the psychosocial, as well as the spiritual aspects of COVID-19. And again, as you mentioned, we'll put links down below to spiritualdirection.com if anyone wants to kind of get in touch with you, either patients with COVID-19, healthcare providers caring for patients with COVID-19. In addition, we'll put down if you are failing to, if you're not recovering as well as Dan and Stephanie did from their infection, we'll put links down below for how to find a physical therapist in your community to help you recover physically and get back to doing the tasks that you want to do at home. Thanks again.